For answering this question, we did a systematic review. In the systematic review, we analyzed three databases and we identified all the papers that were using causal methods to identify the pathway between socioeconomic inequalities and risk, disability, and mortality after stroke. And we found out on 19 studies that the main drivers of stroke risk, drivers of the socioeconomic inequalities in stroke risk were hypertension and diabetes, which show the strongest causal pathway. And smoking was also there, but the evidence was low. However, it is worth to mention. And for disability and mortality, the main driver was severity of stroke at 3 months, and in longer term were the unmanaged cardiovascular risk factors, and again, hypertension and diabetes. And I think what we can do is to effectively target these cardiovascular risk factors in the most risky populations, in the populations that are most at risk, actually. So it would be creating targeted interventions that effectively address the inequality on managing hypertension and diabetes, this in a clinical setting. But it also requires policy that makes access to food, like high quality food, and also green spaces, and for example, restricting the sodium that it's allowed to be in the ultra processed packages, so we can actually impact the populations and not just the individual people, and create like a fairer profile for stroke risk and outcomes.